Բարեկցես սիրելի հայրենակիցներ, ես դոկտոր Ֆրիդա Ջորդան եմ, ոսկրածուծի դոնորների հիմնադրամի նախագահ։ Ես շատ հպարտ եմ, որ այսօր մեր տաղավարում է գտնվում մեր շատ սիրելի բարեկամ եւ մենք արդեն տարիները, որ իրար հետ համագործակցում են, Glendale Adventist հիվանդանոցի ներկայացուցիչը, պարոն Dro Abrahamian-ը, բարևձեզ։
Բարևձեզ։
Ես մեկ հատ բաղագծի մեջ մենք պարոն Dro Abrahamian-ի մասին տեղեկություններ փոխանցեմ ձեզի, որտեղ ձեզի պետք է շատ հետաքրքրի։ Ուրեմն պարոն Abrahamian-ը, մենք իրանք ասենք պարոն Dro-ն, որտեղ շատ հարազատ հարաբերությունների մեջ ենք ընկերական։ Ուրեմն 2 տարի առաջ Adventist Hospital-ի կողմից ինքը փոխադրվեց Միշիգանից դեպի Լոս Անջելես եւ Գլենդելի սրտում եւ շատ մեծ պաշտոն արդեն ղեկավարում է այդ հիվանդանոցի մեջ։ Անգլերենով լինում է Healthcare Foundation, Healthcare Foundation-ի պրեզիդենտն է, տնօրենն է եւ foundation-ը ընդհանրապես տարբեր դրամական միջոցառումներ է ստեղծում, որպեսզի կարողանա շատ կարեւոր պրոժեներ կարողանա հիմնավորի հիվանդանոցի մեջ։ Այս մանրամասնությունները ես կուզեմ, որ մենք պարոն Abrahamian-ի մեր շատ սիրելի Dro-ից լսենք, բայց ասեմ, որ այսպես մեկ հատ շատ կարևոր հանգամանք ստանալը շատ չի տրվում ամեն անհատի եւ մեր հայրենագիցը այնքան կարող անձնավորություն է իր շատ փայլուն եւ հարուստ կրթական եւ փորձառության անցյալով, որ կարողացել է վստահությունը ներշնչի Adventist հիվանդանոցի տնօրինությանը եւ այդ հանգամանքը ստանա։ Պարոն Dro-ն անգլերենը մեկ քիչ, հայերենը մեկ քիչ թույլ է։ Եվ ես կուզեմ, որ մենք անգլերենով մեր հարցազրույցը շարունակենք։ Welcome.
Շարուղախ ենք։
You promised to say a couple of words of Armenian, so you said it.
That's
And
right.
I'm so happy that you managed to come to this interview. I want our audience and all our TV supporters, because we have a lot of people who are following our TV programs, to know who is Dro Abrahamian. What was Dro Abrahamian that he had so many advantages that they moved Dro from East Coast to West Coast to do miracle work at the Adventist Hospital.
Miracle work, that's right.
Yes.
Well, my title is President of the Healthcare Foundation. And what does that mean? A lot of people say, well, that's very impressive, but what do you do? And I raise money for the hospital. And raising money in this economy is pretty tough, as you might imagine, and you do know that. But I like to see it as an opportunity, and I never like to ask people for money. No one likes to ask, dur,
Yes.
you know. And I like to give. I like to give people the opportunity to engage with us on all different levels and be a part of our community. And we have a phrase at the foundation, it's actually our slogan, making a difference together. And that's why we team up with other organizations like your organization, and we make a difference in people's lives together.
Absolutely. And we are so grateful because for the second time, Adventist Hospital is going to be the major sponsor of our annual gala. Annual gala is our top event of the year, where we say thank you to all our volunteers. People get awards for working very closely with our organization, and also Adventist Hospital has been such a kind supporter of this event. This is the second time that they are supporting it. When I came to your office and we met to discuss the ongoing support of Adventist Hospital, there was one thing which you said very rightly, is that this has to be a partnership.
I knew
yes?
you were going to say.
It's not going to be a one-off tour. Give. No, it has to be a partnership because that gives a different meaning to any relationship.
That's right. And as the president of the foundation, one of my duties is actually it's not part of being the foundation president. It's just a different duty that I have at the hospital, is chairing the committee that sees our grant making to the community. And that's one of my favorite things to do, because as I said before, I don't like to ask, I like to give. And this is a way to not just give, but to make sure that there's a partnership, like you said. And we'd like to partner with organizations that have the same calling and the same mission and the same purpose, and that we can actually say that we are in partnership. You know, it's about cancer.
Absolutely.
It's about cancer. And a cancer patient, is not alone in their fight. And it doesn't matter what kind of cancer the patient has, they have their family behind them. And they have their physician and their healthcare workers, nurses, everybody behind them. And they have wonderful organizations as well as the hospital behind them. And together in the community, we're there for the cancer patient. So that is the partnership. And so the hospital feels it's very important for the hospital to give back, not just to be a
donor,
a good a good citizen in the community,
yes.
But to make sure that we are in it together for our patients.
Absolutely.
And many of our patients are have family members that are part of your organization, and that's why we have come together to support.
Yeah. I always admired your cancer unit for two reasons. Why is that? The first one is that it's one of the very prestigious unit in the community, in the greater Glendale community, which is, I think it's partnered with City of Hope, if I'm not mistaken.
Oh, and we do have partnerships.
Yes, partnership, yeah. And the second thing is that the director is our board member, Dr. Boris Bagdasaryan, and his partner, Dr. Nubar Bogosyan, which is very, very admirable.
Well, that's another aspect that we look at when we do give and we create these partnerships, is who is involved in the organization. And it's not just about money, as you say. It's about bonding people with like missions and are going the same direction. And many of your board members are members of either their physicians, like Dr. Bagdasaryan, or they're directors of units like Ramela Markarian. These are people that we know and love, and they're part of your organization, they're part of our organization, and there's that symmetry that we have.
Absolutely. Now, the Cancer Center...
we wanted to talk about the Cancer Center.
Yes,
right?
yes, I love to talk about it, because
there was just an award that came in, actually.
It's
the most prestigious award. Yes.
Well done.
I'm sure Dr. Bagdasaryan can speak more on it.
Yes.
But it was the most outstanding cancer center, and has been given to very few organizations in California. And we actually promoted that, or actually announced that at the gala this year, and honored Dr. Bagdasaryan for his philanthropy at our gala.
That's I mean he is doing a great job. Not only, I mean, he is my consultant. If I get an email from a patient who is asking about his or her disease or what doctors to go to, I always send him for a consultation, and he directs them to the right person. And so it's very important to get the right referrals from the expertise. Well, and that I'm very honored that he's our board member, and he's taking upon himself to be a very good guide in this case.
Well, I have a very personal connection to Dr. Bagdasaryan, and that is my mother actually flew from Philadelphia all the way to Los Angeles and to see Dr. Bagdasaryan. Unfortunately, it was in the last days of her cancer, and she was having trouble breathing when she got off the plane, and she came to Glendale Adventist Medical Center, and they admitted her, and within a couple of days, she passed away, but we were very thankful that she was cared for by Dr. Bagdasarian and that she was in Glendale Adventist Medical Center. I know the unit that she was on, and we're now renovating that. We're doing a campaign for renovations for the oncology unit 2 East to be more like our newer area of the West Tower. And because I like to say that any family that has a loved one in there, I would never want them to have the experience of a dingy place or a wonderful place.
They're feeling very depressed.
Yeah.
Yes, and the one thing which I really admired is that not only there's very good core of doctors working there, but also you have established support groups, the support environment, and even the yoga classes. Yes. Because I remember I was interviewing Laura Friedman, and she was telling me that how comfortable and cozy and friendly and user friendly the whole atmosphere is when you walk in that atmosphere. And
I like to say that those services are free to anyone who's been diagnosed with cancer, irregardless if they're a patient at Glendale Adventist Medical Center or not. We welcome everybody in the community.
I mean, that's fantastic. And I mean, I want my audience to hear it, that if you are a cancer survivor, and if you want to get advice on your nutrition, on your diet, on your physical health, rehab, everything, you can contact. And they don't need to have an insurance for that.
No, that's right. And it's made possible by a new guild that's been created. And a guild is an auxiliary, a group of people that came together because they all have had cancer in their lives. Not all of them have cancer or had cancer, but they have had members of their family that have cancer or had cancer. And it's just like anybody, a lot of people, probably mostly everybody, has someone that they know close to them that has been affected by cancer. These group of people have come together to raise money for the Cancer Center.
I think that's very admirable, and people, I mean, we should talk about it more so people are more aware of this possibility that they can come and join the activities at the center. Now, also, we have had a recruitment done at Adventist Hospital. Now, it's very important because you have a large Armenian physician and staff members. How many, do you know how many Armenians work at the Glendale Adventist? Roughly.
I don't know, but I hear Armenian all the time. I should know more Armenian than I do.
Yes. I remember I was visiting a friend of mine at Adventist, and the Filipino nurse came in and started talking, she was using Armenian words. Actually, that was so comforting for the patient.
Right. We have a large percentage of Armenians that work in all the areas, and it represents the community, at least 30 to 40%.
Yes. Yeah, that's very nice.
Yeah. But interesting. I mean, it's very interesting for me, for coming from Midwest and bringing my family, and everybody was so excited to be a part of the Armenian community, a large Armenian community, and people often wondered, is there an Armenian community in Detroit? And well, we laugh because there's a pretty large Armenian community in Detroit that we were a part of, and it's funny that everybody thinks, well, there's Armenia and then there's Glendale.
Nobody else.
And the former CEO, Maury Dean, used to remark that he, in the lobby of the hospital, would always be two members of the community that hadn't seen each other for years, childhood friends, and they were reunited in the lobby of our hospital. So, Armenian is spoken everywhere and reverberating through the halls, and I feel very much at home because of that.
I had the pleasure of interviewing Mauridin, and he was very, very special. And unfortunately, or fortunately for him, he moved away. went back to East Coast, or
he went to Colorado,
Colorado,
and
yeah.
that's where his family was. So
Yes.
it was very natural for him to go to Colorado. It's very important, and a lot of the community felt that it was the right thing to do because this community especially is so family focused,
Yes.
and this hospital is so family focused that it was very, very much in line with the right thing to do was that he was there for his family.
Yes.
Not just his wife and his children, but his brother and his father.
That's very nice. Yeah.
And he's doing remarkable things in Colorado.
I'm sure.
So we welcomed Kevin Roberts.
Yes.
And Kevin is very much into improving the hospital and has taken great strides in making Glendale Adventist a better hospital.
Well, that's great. And I hope one day I'll have the opportunity to meet Kevin Roberts and even to see him at our event, at the gala event on July 15th.
And you can say aloha to him.
Aloha.
Because he's coming from our sister hospital in Hawaii.
Okay.
That's right.
I have a very close friend, director of Transplant Center in Hawaii. So Dro, what are the major new projects? Because each new administration brings new ideas, new projects. What are the most new challenging projects that you have on your hand?
Well, for fundraising, we have an initiative. We don't have a major campaign. We're actually, we have the opportunity now to question our top donors to find out what their interests are. So our fundraising has become very donor-centric, and that is that we're taking the time to listen and get the donors their opinions, their advice, ask them a favor, and then finally find out what really interests them. But we do have initiatives. I mentioned the renovations of our oncology unit in the East Tower. That's an exciting project that we're looking to get started and end within a year and a half or two. So that's the building part.
Any new wings you're adding to the hospital? No? Or that's enough?
Well, everybody always mentions the crane that was out there when the West Tower was going up, and the new unit that connects the West Tower and the East Tower. People always are amazed at the growth of the campus. Now we're concentrating on the growth of our quality, and we're really, really keen on making the patient experience the best experience that they can have. So that's what we're working on right now. That's what the building is all about.
That's very good, and I wish you all success. I'm sure the new administration with it's a new blood to brings new blood to the hospital. With your guidance, with other physicians, and with your colleagues like Romela Markarian. She's been with us for long years. And she's a devoted supporter of ABMDR, no matter where she goes. Yeah, and we are very honored to have her as our board of advisor.
Well, that's part of the partnership, isn't it?
That's right, that's right, that's right. So again, I like to extend my thanks for yet another year of support and becoming a major sponsor of our gala, which is going to happen on July 15. I need to say a couple of words about July 15. It's going to be at the Glendale Hilton. As always, it's the last 12 years. It's so funny because after every event, we say we have to change venue. Yeah. But we always go back to Glendale Hilton because they give us the best service.
That's okay.
And the best price.
There are angels there that fly around I'm sure the angels will be back too.
Absolutely. And if your kids, they want to be an angel, they're more than welcome to become angels. So we're going to have a very nice event, very prestigious, and whenever people come to any of our events, they always come back because, as you say, there is something which is so striking, and those are the angels. It's the lives that we are able to save, the people who really look up our organization as their last hope of survival, and together with our new
together.
partners, we want to deliver whatever we can to our patients.
Well, it's one of the best events in the community, and we're honored to be a partner. And but like you said, we don't just give to just give. We enjoy. We find not only what you're doing is important, but it's effective. And just reading your newsletter shows all the successes that you've had. And no donor wants to support an organization that isn't successful. So we're proud to be a part of you because you're so successful.
Thank you so much.
And we enjoy ourselves when we come to your gala. So that keeps us coming back. It's not just your successes, but it's also we enjoy and we feel that joy of giving that I hope other donors will enjoy that sense of giving back to your organization.
Well, we wish you to have very, very effective fundraisers, because the more fundraising you do, the more you can help the community and the more you can donate to the other outreach programs. So I wish you all the best.
Right.
And also thank you for supporting our newsletter. You mentioned the newsletter. Advent has always been on the front page, and we don't forget that. And also, you know, our other events like walkathons, you always had your booth and your presence, and that is really appreciated. Now, saying that, I say thank you for coming, Dro. It has been a great pleasure. I remember first time I met you at our April 24th in Montebello.
Oh, that's right.
We were doing recruitment under sun, very, very hot, but you came and we started talking and we said, how can we work together more?
And that was my first week, I
That
think,
was
on the
your
job.
first-
That was 2 years ago, and
Yes.
it was my first week.
Yes.
And I mean, I was there not on an official capacity, but I'm always doing business.
Well, thank you very much. You have gone a long way. I wish you all success, and we are so proud of you. Thank you very much.
Thank you. Շնորհակալ եմ։
Սիրելի հայրենակիցներ, ես վստահ եմ, որ դուք կիսում եք մեր բոլոր մաղթանքները մեր շատ սիրելի Dro Abrahamianին, որ ինքը տեղափոխվեց արևելյան ափերից արևմտյան եւ այսպես մեծ հաջողություններ արձանագրել, Աստված իր հետ, իր ընտանիքի հետ, ինչքան մեր հայերը կարողանան ավելի հաջողվեն, ավելի մեր ժողովուրդը, մեր հասարակությունը, մեր ամբողջ հանրությունը ավելի շատ կհարստանա եւ կօգտվի իրենց փորձառություններից։ Մինչև գալ անգամ ստեյշ ձեզ։ Շատ շնորհակալ եմ, որ այս ժամը ձեր մեր հետ կիսեցիք։ Ստեյշ ձեզ։